welcome to the Learn How NHS Blood and Transplant Transform the HR Function with ServiceNow and Partners in IT webinar. If you wish to ask a question during today's event, you will just need to post your question via the Q&A tab and hit submit. I would now like to hand the call over to your speaker, Mr. Berwyn-Jones. Please go ahead.
Thank you. Good afternoon, everyone. My name is Berwyn-Jones from ServiceNow. During this afternoon's webinar, we're going to hear from NHS Blood and Transplants. They are a national NHS body in the UK, responsible for the safe and reliable supply of blood, some stem cells and solid organs to hospitals throughout the UK. We're going to hear from NHS Blood and Transplants how they used ServiceNow to rapidly deploy and deliver an HR solution that is actually used by all of their staff throughout the UK. Before we go straight into the presentation from NHS Blood and Transplant, I'll quickly hand the call over to Paul Jenkins from Partners in IT, who were the implementation partners responsible for the delivery of the solution. Paul.
Thanks, Berwyn. Yes, good afternoon, everyone. My name is Paul Jenkins. Just a couple of housekeeping things before we begin with Shane. As mentioned, we'd like to issue some polls intermittently throughout the presentation. Hopefully they won't be too disruptive. I'll be grateful if you could take the time just to answer these. They're fairly quick, multiple choice questions. Also, if you have questions that you'd like to pose to Shane, it would be helpful if you could engage with us through the chat facility. I'll then collate those questions and at the end pose the most prevalent back to Shane rather than trying to disrupt him too often during the course of the presentation. So please pose the questions and we'll get to that at a Q&A session. Briefly, on Partners in IT, I work across the public sector and also the commercial arena. Partners in IT have had considerable success in both those sectors, particularly in collaboration with ServiceNow, where we help engineer and drive the service transformation agendas that are now so prevalent as both public and private organisations challenged to do so much more with so much less, both within the traditional IT domain and more broadly in service relationships across the enterprise. So our work with NHSBT is a great example of this, and I'm pleased to introduce Shane White, who will describe the challenges and the journey that his organisation has been on. Over to you, Shane.
Thanks, Paul. Good afternoon, everyone. As Paul has said, my name's Shane White. My day job is as HR lead for the Organ Donation and Transplantation Services, part of NHS Blood and Transplant. But for the purposes of this webinar, my role was as project lead and business lead for the project that introduced these changes. What I'm hoping to take you through in the next 35, 40 minutes is just a very brief overview of what we've done within our project and how we've used ServiceNow to support that. But it's not just a presentation about a technology solution, it's a presentation about what our change is, but where that technology has helped us to deliver some benefits both to our staff and our managers. So what I want to cover today will be to take you through just a little bit of an overview of what NHSBT is, who we are and what we do, and then take you through some of our challenges. Why were we doing this? Why did we start this piece of work? What were the drivers and what were the things we sought to change? And then following on from that into what is it we actually did. So you get a flavour of the journey that we went on in terms of how we managed to reduce cost, change and improve our processes, but at the same time not detract from the service that our customers were receiving from the HR team. And that leads us nicely then into how we utilise ServiceNow as a product within that change. And I'll give you an overview and a flavour of what ServiceNow does for us and how it's been very helpful to us. So NHS Blood and Transplant, who are we? Well, our core purpose is to save and improve lives through the provision, as Berwyn has already introduced, to save and have an effective supply of blood and blood products to the NHS. For blood and blood products, just to clarify, that is only within England and a small part of North Wales, but for solid organ transplants, it's across the UK. So can I just double check if you are getting the slides? It should now be on slide 4 for the organisers. We seem to have lost the connection at my end.
Jane, no, we can only see your first slide at the moment. It's now just come up, so we're on the same page as you.
Okay.
On slide 4. Yeah.
Okay. So I think what's on there at the moment is just a breakdown of some of the types of areas that we get involved in terms of provision of blood, provision of banked cord units, and organs transplanted. As an organisation, we are set up as a special health authority in England and Wales, and also as an arm's length body to the Department of Health. That in itself causes us some challenges, because not only do we face the cost reduction pressures that the mainstream NHS are facing, but we also are under challenges of central government in relation to restrictions on expenditure and seeking to share services across arm's length bodies. And trying to marry and navigate our way through both sets of challenges is problematic for us, but in effect gives us a challenge to reduce our costs overheads at all opportunities, with a view to returning that investment back to the NHS. In the last 2 years, due to organisational change and reductions in efficiencies within NHS BT, we've returned approximately £30 million back to the mainstream NHS budget by reducing the unit cost of a price of blood. Some of our unique challenges as an organisation are around the fact that we are probably the only NHS organisation that straddles the 4 UK administrations, which again gives us some challenges in dealing with the individual governments and different variances in terms of conditions and different approaches to how they wish to see organ donation and transplantation services provided in each of their respective domains. It also gives us a challenge in terms of managing our staff and managing our HR teams, because, as it says on the slide, over 50% of our staff on a day-to-day basis work remotely or in venues that are not our own. On average, on an average day, we collect approximately 7,000 units of blood per day via 100 teams that are in 100 separate venues. And those venues could well be school halls, village halls, etc. So that challenge for us there is around connectivity, remote working, and just generally having those teams feel engaged and involved with the organisation. Traditionally, as we are the only organ donation and blood supply provider in the UK, we traditionally look to benchmark our services internationally, and we are part of a number of forums in relation to blood across Europe, the US, Canada, etc., and for organ donation with countries such as Spain, Croatia, Canada, etc., that lead the way in organ donation. So I'm hoping just to have given you a flavour. Whilst we are deemed as a special health authority, we very much see ourselves as a frontline deliverer of NHS services, and we face many of the same challenges that large acute providers would face, just geographically more dispersed than some NHS organisations. Other than that, our challenges are similar and the same as many of you will be facing. So our HR function, as you might have expected, was previously structured and has to be structured to support that geographical spread of services, and that in itself caused us problems. I think if I could just ask the organizer to take over the movement of the slides. They seem to be taking quite a gap between them moving. That would be very helpful. So our HR services prior to these changes were, as I said, geographically spread across the country. We suffered from a long history of being very heavily policy driven, very prescriptive in our approaches to HR, and in many ways HR staff managed processes rather than line managers. So starting out on this process, there was very much a need for us to seek to change not just the structure and the approach to the delivery of HR, but also the expectations and the culture relating to our managers who had grown dependent on a very hand-holding approach from HR. And that was something that we couldn't sustain going forward. Some other features that we sought to address was that we were very hierarchical in structure. Prior to the changes, there could have been up to 7 levels, but for most people 5 levels of management between the local team, through regional teams, through national teams, onto the national management team, and that was just ineffective in delivery. Slow, also meant a fair degree of miscommunication, and just was inefficient. And in relation to this presentation, I think we were very poor with our use of technology. It was a very paper-driven function. I almost hesitate to call what we had in place systems, but we were using things like Excel spreadsheets to manage casework. There was very little to manage day-to-day queries and low-level queries. They just weren't recorded. So centrally, as a senior team, it was very difficult for us to understand our activity in the various regions without a significant degree of manual effort to pull together information. And then the final sort of driver was we, as a arm's length body of the Department of Health, were asked to, or we were required to take part in a piece of work that was looking at the potential for shared services across the arm's length bodies. That piece of work commenced with a benchmarking exercise relating to ratios of HR staff to employees and cost of HR to the overall budget per member of HR staff. And what became very obvious was that we suffered in comparison to the ALB averages for our comparable organisations, but also to the Cabinet Office ratio of 1 to 100, so 1 HR member of staff to 100 employees that we were being asked to move to. Could you move on to the next slide, please? Prior to the changes, we were at around 1 to 52 in our ratio, and after these changes, that ratio has lifted to 1 to 78. So we are not complete in what we're doing. We are partway through our project of change. However, in relation to the HR side of it, our frontline operational HR staff are now operating to a ratio of 1 to 250 to 1 to 300. supported by some more centralized services, which I'll go on to explain in a moment. The area where we are still less favorable in comparison to our benchmark organizations is in relation to our training and development function. And that is primarily because for the vast majority of roles that deliver our services, we don't have a ready supply of other employers, or we can't draw trained people into the roles. So we have to invest quite significantly in specialist scientific and technical training, blood collection training, and specialist training for nurses and organ donation, who just don't get that training elsewhere and aren't skilled for the role. That requires us to have a larger training delivery function that we don't necessarily see in some of our competitor organisations or comparator organisations. So if we could move on one, please. So what were we trying to achieve? I think for my HR colleagues who are on the phone, there are a number of models that I'm sure you're aware of, the Ulrich model and others that have been prevalent in HR for some time. This is just another variant on that, and our journey in this respect is no different to the vast majority of HR departments that I'm aware of, where we were seeking to make sure that our basic processes of administration were transactable and were devolved to the line where possible. But we were very, very clear that we didn't want that just to be seen as a dumping of HR activity onto line managers. It had to be done in a way that was straightforward and easy for them to pick that activity up. Our challenge was to make sure that our policies and processes enabled that devolution to take place, to allow our staff to focus on using the specialist skills that they have through their training to intervene in more complex workforce issues that they should have been intervening in but were not. So just to give you an example of some of our challenges, one of our regions in the northwest, for example, would have had 2 HR managers previously, covering an area stretching from Cumbria down to Stoke and up to the Pennines and across to North Wales. But the HR team there were based in Manchester. So when they weren't on site visiting teams in that geographical region, managers would store up queries until they were back on site. The challenge for us there was we were having relatively senior staff dealing with whatever walked through the door, and invariably that ranged from a large percentage of very transactional activity, where's this policy, how do we do this, etc., through to the more complex and grievances and disciplinaries, for example, and they were just finding their time too stretched, and managers were struggling to get availability. Okay, can we move on to the next slide, please? So what did we set out to do? What was our project approach? Well, we set out to make sure that if we were making this change, we didn't want to just do a structural change, i.e. change the boxes without changing some of the more fundamentals. So we undertook a piece of research, first of all, that lasted approximately 2 months, and that involved us visiting a number of external organisations, including NHS Cheshire, which is an NHS organisation that had set up a shared service arrangement for a number of organisations in that geographical patch. We looked at comparator organisations that were spread over a large geography, people like the Royal Mail and a third sector organisation called New Dimensions. But we also spent quite a bit of time internally speaking to our own staff, our HR staff, and our managers. And the question we were posing was not what would you like us to do, but more, if we weren't here tomorrow, where is it that you want us to add value? Where is it you want us to be contributing to your challenges? And that, plus all the information we gathered from our internal and external research, formed our formal proposal for structural change. So in our structural change consultation, we reduced headcount by approximately 10% across the frontline teams, introduced a new front entry team called HR Direct, and went through that period of making job description changes and role changes. As we exited that formal consultation phase, we moved into what I'm calling here our transformational phase, but that is where we started to redirect our activity into the new services and freed up our what we now call HR consultants to start to adapt a more of a consultancy approach and support our managers in that way. Running parallel with that, however, we were fortunate, and I would say it was fortunate, that our service desk and IT department were coming up to retender for a service desk application to support our IT help desk. And we had a conversation between myself and the lead for that project and worked out relatively quickly that our requirements were similar, in that if you strip away the content, the basic functions of an IT service desk and a HR help desk were very similar. We needed to know who was calling, what was their query, we needed to make sure it was allocated and dealt with, we needed to record the advice or the intervention made, and we needed to know when things were closed or escalated. And once we understood that those basic requirements were the same, it became very obvious to us to do a joint procurement. So that procurement process finished in contract signed in July 2013, and in August, the start of August, our implementation partners in IT came on site. We then commenced a period of 6 weeks where, so if you can just move on one more slide, where we used our approach of designing and building the product to completion and testing within that 6-week window. And I'll talk a little bit more about that when I talk about the system itself. What I've just put on screen here again is just a service overview, which I'll take no credit for its formatting. This is shamelessly borrowed from the BBC, which is one of the organisations that we visited. But it's a format and a service overview that is not unfamiliar, I would imagine, to very many of you, particularly if you work in the HR field. And it just describes what we were aiming to achieve, which was a front entry into HR through one route. And for us, that was the creation of what we've called our HR Direct team, which for all intents and purposes is a help desk team that deal with what we understood to be 80% of our activity, which was very transactional in nature. And that's one central team based in Bristol, but they field calls from across the UK. That for us was a very significant change if you bear in mind the culture that I mentioned earlier, which was very heavily reliant on HR. And the idea was that the HR Direct team would deal with the vast majority of queries and only escalate to the regional consultant teams the more complex cases that required either meetings with individuals or going through formal policies. The idea behind that being that the consultants would then be free to implement our new approach to consultancy, which I will talk about in a moment. And this slide here just gives you that overview about how you would interact with our department through to the strategic business partnering team that we have allocated to each directorate. And we tend to use the term business partnering to mean our divisional HR directors in effect. We operate in a group services type of mode where we have distinct businesses managed as a group of functions. So if we just move on one more slide, please. So what this slide is trying to show you is just to draw some of those themes together, because what we were very, very clear about, as I said earlier, was that this wasn't to be just a structural change. We needed to look at all of our people-based changes, our process-based changes, and our technology support. So on the people side, that primarily is about refocusing of roles, reduction of headcount, introduction of the new entry point team through HR Direct, and the new structure. On the process side, what became clear as we went through this project was that we weren't entirely clear about what our processes were. We kind of knew things got done, but could I put my hand on documents that said this happens, then that happens? No, and that was something that we hadn't spent time or seen the importance of investing in. And so we went through a process of mapping all of our key processes and understanding what the interactions were. And for any of you who have been through that, I'm sure you will agree that it's a very enlightening thing to do. It became very obvious why things were getting bottlenecked, why things were getting confused, because we were making things more complicated than they need to be with multiple handoffs that weren't necessary. And just by doing that exercise, it has identified that to us. I think what it also drew out from our research with other companies was that the best performing HR functions had a dedicated resource that looked specifically at the improvements needed within the service and thought of the HR function as a service to customers. And we just did not have that capacity or capability within the team. So as part of the people-based changes, we introduced a service improvement team. When I said team, it's a couple of individuals, and what their role and remit is specifically is to look at continuous improvement. So in the last year, we have been redoing most of our policy framework to reduce steps and to give increased managerial discretion and to make those processes flow more smoothly. But the service improvement team have used and continue to use the process mapping skills that they developed to look at and continually refine what it is that we do. And that is what I would probably call an opportunity-rich environment at the moment, but we are on a 2-year plan and we're about 50% of the way through that to improve that side of things. And that would not have been possible if we hadn't have gone through the process mapping. That then led us to technology. As I mentioned previously, we were very poor in technology, but there were a number of things happening in the wider NHS around some of our systems around recruitment and what's called the electronic staff record, which is the core national personnel record and payroll system for NHS organisations. So we weren't necessarily going to look for technology solutions in that territory. What we wanted to do was to enhance the offerings from those systems, and that's what led us to ServiceNow. If we could jump to slide 14, please. So I mentioned previously the fact that we were changing our HR consultants from HR managers who were interacting with line managers and supporting them frequently. To do that, we've introduced what we've called our HR consult model, which is based on industry standard consultancy models that talk about building and engaging relationships and then taking individual pieces of work and projects through a very defined process to ensure that we were doing some of the things that we weren't necessarily doing before, which was examining other solutions and other potentials, plus also making sure we looked for benefits and evaluating our projects that we were actually implementing. Where we are currently is just embedding this with our HR consultants and skilling them up in the key skills required to be able to adapt to this model. Under each of the boxes on this diagram, there is a whole series of supporting information about the types of key questions and expectations at each step, and that's probably a presentation in its own right. And if anyone is interested in understanding what we've done in this territory, then please feel free to contact me after this webinar. So if we can move on a slide, please. Looking now at specifically at ServiceNow, I said I would come back and describe a little bit about how we introduced the system into NHSBT. Now, where we are using ServiceNow specifically is in relation to the handling of queries and cases, which is the bread and butter of our HR activity. I've already explained that we've gone through a joint procurement with our IT team, and that was very beneficial, not only in terms of ensuring that we had a single corporate platform that would be usable in multiple corporate services, but also in some very practical things like getting access to the right people to make the implementation feasible. As it was a system core and dear to our IT department, we were able to get that support that we needed, which may have been slightly more challenging if we were trying to do this as a standalone HR team on our own. I've talked on this slide about the aggressive implementation timescale, and it certainly felt that way at the time. And that's primarily because the out-of-the-box offering from ServiceNow for HR was very light and required significant customization to make it fit for our purpose. But we had a very clear timetable where we had to be ready to deliver the new HR structure, the new HR direct team at the start of November. And I had an objective in my plan to make sure that we had the system available and ready a good month before that, tested and ready, so that I could communicate with the organisation with confidence that we would be able to deliver a new service on day one that wasn't going to fall apart either due to technology or people issues. That then meant that we had a period of 6 weeks where we went through the specification, the design, the build, the user acceptance testing, and the sign-off of the system for use, for training and implementation. I'll come on at the very end to talk about some of the things that we found were required to make that happen and beneficial from that. But what was very clear to us during that period was it was key to have a strong relationship with our implementation partners, because we, on both sides, needed to learn and understand each other's language and understand what the other could bring to the party. That was something that was very key to us, and I think when I look back at it, it was very, I don't think I understood fully at the start of that period what our true requirements were, and it was only through working together that we were able to work out this is how the system might be able to support us. Likewise, I think it was an educational exercise for partners in IT to understand some of the intricacies of HR cases and where they may differ from IT tickets and IT queries. And that was primarily around things like confidentiality, the content of information, but also the fact that actually, whilst I talked about process mapping earlier, most of our processes in HR terms were not completely linear, and therefore the system couldn't be built in such a way that it forced us through steps, because when you're managing some cases, it's much more difficult to agree what's going to happen next, and we needed that flexibility to be able to take different process terms. So on this slide now, you will see that we had to start introducing some common language into our HR team. I don't know whether that is similar in some of your teams, but for example, when is a meeting a panel or an appeal or a hearing? We had to go through some of those debates to make sure that what we were building was very consistent, and people, users who were using the system, would understand where they were in a particular process of managing a case. We worked through primarily queries and cases. As I described earlier, queries are In our definition, basically any question or request that's made to HR that requires a response, we need to be able to log those and know about those, whereas a case was something a little bit more complex. You still need to know the same things for a case in terms of who's raised it, what the advice is that's been given, etc. But they just need a bit more and often involve things like panels and hearings and potentially tribunals, etc. Can we move on to slide 17, please? So what I just want to do on the next couple of slides is just show you a couple of screenshots in terms of some of the features that are useful and helpful to us in our day-to-day management of the HR function. And the first couple of screenshots relate to what is effectively one page on ServiceNow, and this is the landing page, the HR homepage that all of our staff go to first and log into when they log in the morning. Some of the features on here that are interesting to note. We have a news bar, which for those of you who watch Sky Sports, it's that sort of news ticker bar that flicks across the bottom of the screen. That is very useful to us in terms of passing messages to the HR team or updating them with knowledge. We can place an article on there, and we can make sure that they see those updates, be that a policy update, training updates, or how they should be approaching a particular issue, or if we're having a very heavy peak of queries relating to a particular topic, we can make a message or put updated advice on there for HR users to pick up on. At the top of the page, we have interactive tables which pick up all of our HR groupings and role profiles across the top, and down the side are our business units. And this just shows various kinds of caseloads and queries. What I should say actually is that all of these screenshots are off our development site and aren't off our live site, so therefore there's no data on here that is live. It's all test data that was used in our testing period. Some of the neat features on here are that if you click on any of these numbers, it brings up the individual cases, so we're able to see by relevant HR team or directorate what is happening in those areas. Can we move on to the next slide, please? So sitting just below these tables, we then have what has turned into probably the most used part of the home page, and it's these what we call HR summary counts, and these show cases and queries and workload that have been allocated to individuals within the last 7 days, either to them individually or to their group. And again, it just gives a very quick view of what's happening in your local area, and you can see very quickly if activity hasn't been picked up and dealt with. There then is some very more national summary counts relating to appeals or critical items, are those things that are set to a critical priority that need to be actioned more swiftly. If we move on a slide, please. So just beneath those, then on the same home page, there are a series of graphs, and these are user definable and was part of what we went through when we were doing the build, and allows us to see all live or closed cases and queries either by state, by policy area, by category, or by breaching the set SLAs. And again, these are helpful for just helping us navigate what's in the system. Can we just move on one more slide? It's not possible to sort of take you through all of the features that we've got on the system. This is just to try and give you a very high-level overview. But this is just to give you an overview of what a query might look like. So what I would take from this is that it's got all of the key information that you might want in relation to a query, an automatically generated number, which allows us to manage our queries, allows us to categorize the query via our predefined processes and categories, and allows you from this page to either capture the advice given, which I'll show you in a second, or to allocate that query to someone else. And as soon as that's been allocated, that then shows up in their work queue or in their summary counts as allocated to them. Okay, if we just move on one slide. What I showed you in terms of a query view is very similar for a case. It's just that on a case we have various additional elements relating to what's called work notes, and these allows you to record the advice. And if you look at the bottom of this slide where it says a full audit trail of all updates, you get a feel for what the work notes look like and allow you to do. And what you can see on there is that it records both the date and time and the user that's made the change. But in the green to the side of my name, you'll see it also shows you what has been changed. So at any one time we can print off or have sight of or view a full case history, which is something we were never able to do before. Some other useful features on there that we went through in our implementation build. I think we give our implementation partners some headache around our attachments. For HR cases, as you know, we may well often have multiple attachments relating to a large disciplinary case or a large tribunal. We needed to find a method of being able to show and categorize those and attach those to an individual case, and we've got a method of doing that through attachments. Some of the other little features in the middle of the screen there that are very important to us are icons which will, if they were clicked on, will bring up any other related queries or cases for that particular employee, which means that when our help desk are speaking to employees, they can be looking to see if there's anything else open that they can also resolve while that person is speaking to them. And the last sort of helpful feature on here, which is worth noting, is I mentioned earlier our national NHS ESR system. What we didn't want was our HR staff dropping out of ServiceNow and trying to load up ESR, which has its own connectivity and speed issues. So we have built a method of getting an interface of information into ServiceNow, so that if you hover over that icon, a pop-up will pop up with a core data set of information, which allows the HR member staff to easily look at both employee-related data and assignment-related data. So things like what's the job role, what's their salary, what's their service dates, and things that they may need to have access to and quick access to deal with the query. If we move on one slide, please. So where are we now? I think we were cautious about how our HR team would take to the system, given our low level of technology before. But given its very easy interaction, it's very clear and obvious what you do in ServiceNow. We've just not found that transition to be difficult. I often quote that within 20 minutes, 10 minutes of us going live, practically all of the HR team had been onto the system and started loading their historical cases on. We allowed 4 weeks for them to load all of their historical cases on, and that was all complete within 2 weeks. And the feedback we've had has always been around its user friendliness. Some of our main project was, though, to strip out some of the transactional activity from our specialist staff. To date, since we launched in November, we've dealt with just over 4,000 queries and about 825 cases. We'd originally set, based on our experiences elsewhere, at 80% completion within that first level HR direct team, and we set an SLA on 2 days for that. Our current performance is that we're actually closing 79% of queries on the day that they're raised, and 87% within the 2 days. And I think that is in part down to the system and the fact that we've got good visibility of what's happening at any one time in real-time information, but it's also to do with our improvements to processes and the getting the people right in those roles. Just in terms of helping others who might be thinking about going through this, because one of our big things that we struggled with was how would we understand what our call volumes would be and what activity would be going through the the team. Based on all of our visits, we were able to work out a ratio of roughly 100 queries to that frontline team per 1,000 employees per month. Seemed to be a standard sort of ratio based on all of those places we went to visit previously. However, what I would say is that's pure HR queries. The other services that may include other employee-related queries like payroll-related queries will have a higher ratio, but that just gives you something to work on if you are considering looking at something similar. Where are we now? We're just about to launch in hopefully in 10 days' time our online knowledge portal, which will be a searchable database within ServiceNow, but accessible through our intranet site, where we are now starting to look at how do we deflect work away from the HR Direct team and allow managers and staff to deal with their own queries. And we're also looking at increasing the amount of automation and workflow for some of our processes, which ServiceNow will be helping us with. So can you just move on one more slide, please? So what have we learned having come through this process? For us, learning and understanding our processes and being genuinely understanding what we do and what's going on in the function has been invaluable. The fact that I can tell you how many queries we're closing per day and how many we've had over the last 6 months is something we just would not have been able to do this time last year. The fact I can tell you what our most common queries are and who our most frequent managers are. Again, information we just didn't have before. It's also allowing us to manage our more complex cases with a higher degree of rigour, because we're able to spot delays in the processes and intervene, which were things that may have had a time delay because that information just wasn't accurate and up to date under our previous systems. Learning to seek the opportunities with other services like IT and the suppliers. I think it's easy to look for differences, and really what we should have been looking for was the similarities, and that was really quite an important lesson that we learned. Your implementation team, if you are going to go down this route, it's important that they have the ability to make decisions and make design decisions quickly. That speed and flexibility for us was key and fitted in with the implementation approach of using conference room pilots that we used to go through our build. I think what's very clear to us is that we've limited the system capability, not the other way around. There was more things that partners in IT were telling us that we could get out of the system. We chose not to take them on at this stage, simply because of our low level of technology starting points. But that is something that we're now building on. But we chose to keep it simple but working. Our big issue for us was about getting our communications and engagement working. Given where we are currently 6 months in and having dealt with over 4,000 queries, we haven't yet had a single formal complaint about that service. And given the experience of people we spoke to elsewhere, frankly, I think that's remarkable, particularly given the high dependency that we had previously. So if we move on one more slide. I'm hoping that I've given you sufficient oversight of what we've done at NHS BT. I think what we've done with our HR function in terms of moving to a frontline help desk with specialist advice sitting behind that is not something that will be unusual or unique. I don't believe that to be the case. I think most HR departments have either done that journey or are partway through that. I think what I would say is that the combination of getting our processes right, our people right, backed up and underpinned by supporting technology, means that we have genuinely transformed our HR services within NHS BT. And to have our Director of IT and our Chief Exec openly talk about this as being one of the most significant transformational changes within the organisation, delivered in a shorter time than was expected, and to a standard that has reduced our cost base but increased our customer service is something that we feel proud about. So if we can go on to the last slide, please, or the second last slide. So what I would say to you, if you are in a similar place where you need to do more for less, you need to want to increase your customer experience of interacting with HR services, and you don't have a query system or a case management system in place, then this might be something that might be of interest to you in pursuing. And that's the end of the presentation as such, but my contact details are on the last slide, along with our implementation partners in IT. Feel free to take my details down, and if there are any follow-up questions or information that you want more on any aspect of what I've spoken about, I'm more than happy to speak to people post the webinar.
So Shane, thank you very much. This is Paul Jenkins, Partners in IT. That was excellent, and happily enough, I think for all the attendees, wasn't simply a diatribe about the technology, but more about the challenges you face and the journey that you've been on. I will try and just bring together some of the questions. Some of them are repetition, so I'll paraphrase and pose them to you, mostly Shane. I think if we get into any technical details, I'll come to John Perks, one of our consultants. So one of the key questions that's coming from several people is around the major issue or impediment to the project. So given the tight timescales that you're working to, are there any signal issues or impediments that you had to overcome, whether political, commercial, technical? What do you think was the standout issue that you had to address?
Well, okay. There's probably a couple of things. I think if I take some of those categories, our biggest political issue was making sure that we genuinely had the sign-up of the relevant stakeholders who had power within the organisation to make that deadline happen. So getting the HR changes scheduled first to go live on the project, and the negotiation to make that happen was vital to us to deliver that. I think technologically, I think our biggest issue was being clear about what our requirements were in a format that people from more of an IT background rather than an HR background would understand. I think we struggled to articulate our requirements up front, other than we want to do this and we want to do that, which was our starting point. If I was doing this again, I would probably be better versed in how to do that. I think our challenge was also around we needed to do something quickly, because you saw some of the benchmark information. We were not in a great place, so we had a challenge to warm up the organisation and our own HR team that this was the way that we were going. So we had faced inevitable challenges around people who haven't been using this type of system before, and you had to have the right skills. How are we going to use it? Is it Big Brother? Are they going to be looking at what I'm doing? And what we were trying to get across was actually the benefits is not about that. The benefits is more about ensuring that we give consistent and professional advice, whoever we are within the team, and that by introducing this frontline help desk service, we were going to improve the experience for line managers, where they would traditionally try and walk up to a HR member of staff in a department, but if they weren't there, they would wait days to get their query resolved until they were back on site. And one of the biggest selling points for us was pushing the fact that there would be a team available all the time to respond, that they would know the information about them, and it would be professionally handled. And that's the bit that's been the winner for us. But dealing with the challenge of people not being able to see that as a benefit in the future was a problem, which is why we had quite a detailed engagement plan leading up to the launch.
And what resources did NHSBT have to assign to the project? What sort of level of effort was involved from your end?
Okay, so that varied throughout the project. So in the procurement phase, it was primarily myself leading that from the HR side, and an equivalent business lead from the BTS side. And we did that through a project structure of a project board of more senior directors, and then two business leads. When we got into implementation, we had myself and two others, one of our service improvement leads who was also an operational HR regional manager before the changes, and one other. And we then utilised different HR staff at different points in the process. So we would hold conference room pilots, conference room sessions with a cross-section of HR to say, right, this is where we're at the moment. What does this look like, feel like? What changes we need to make, and move on. So it was probably two and a half full-time equivalents for the 6 weeks, pretty full on. But other than that, it was dipping in and out for others.
Okay. And could you, if pressed, pick out any outstanding features of the platform, the ServiceNow platform, that have really made the quickest or most significant differences? So maybe thinking of quick wins within the tool set that landed and were perhaps of greater impact.
Yeah, I think being able to get the attachments onto a case meant that we were able to decommission all of our legacy case systems. Being able to get that problem resolved was vitally important to us. The interaction with the ASR data is really important because for NHS colleagues who are on the call will recognise some of the speed issues you can get with ASR at various times, and just to have that information easily available, readily available at a hover means that a lot more of our calls can be handled and closed there and then because you've got the data in front of you. The fact that all of our HR users can log on at any one time, so what I probably didn't talk about too much was how this is all hosted, etc. But it means we don't have any restriction on our users. All of our licensed users can get on at any one time, so it's all live and updatable and visible as soon as it's done, which has just reduced the volume of chasing, effectively people chasing updates and understanding where cases are. I think those are probably the key features for us.
And perhaps apart from giving yourselves a bit more landing room in terms of the timescales of the project, what would you pick out as 2 or 3 of the things that you would do differently if you're approaching this kind of engagement afresh, but with the knowledge that you've gained? So in a way, that's kind of a summary of the lessons learned, but maybe the standout lesson learned?
To be honest, probably be more ambitious. Because I think we could have done some of the stuff that we're now doing at the moment about more automation and more workflow than we are doing. And we are doing some of that, but it just hasn't been part of this presentation, but we probably could have done more of that. What else would I have changed? Probably would have although I've talked about the benefits of the ASR interface, that's provided by yet another provider. So getting that piece of work up and running earlier would have been of great benefit because the McKesson that run that haven't been as helpful or as considerate to our timescales as we may have liked them to have been.
Okay. I'm conscious that we're coming up to the top of the hour that we have allotted, so thank you, Shane, for answering those questions. We do have some other questions which we can come back to attendees individually on. Of course, you're all more than welcome to contact myself or Shane after the event. We will be making the slides available and a recording of the presentation available in due course, both on the ServiceNow website and the Partners in IT website. But for the moment, thank you all for making the time this afternoon, and thank you again, Shane, for putting so much effort into preparing the presentation. So with that, I'll close off the call, and hopefully we'll have an opportunity to speak to some, if not all of you, in the course of the next few months. Thank you again.